Greetings. I am from Group 8, Team 16, and our members consist of Ivy Lu Su Ching, Muhammad Firdaus bin Rafandi, Garrett Anak Josiah, Beckham Ngumbang Anak Desmond, and me myself, Melvin Jinap Anak Peter. And our group is going to discuss regarding the common types of sleeping disorders that are found in the medical field.
So today we are going to present about the common types of sleep. But before we proceed, I will talk about the definition of sleep disorders. According to American Psychiatric Association, sleep disorders are the conditions that affect the quality, duration, and timing of sleep that can cause complication in daytime and disablement of proper function of an individual. There are a number of causes of sleep disorders, which includes underlying medical condition and mental health issues. There are numbers of common types of sleep disorders, which includes narcolepsy, sleep apnea, restless leg syndrome, insomnia, and para-insomnia.
Narcolepsy is a lifelong sleep disorder characterized by a classic tetrad of symptoms, which are excessive daytime sleepiness with irresistible sleep attacks, sudden bilateral loss of muscle tone or cataplexy, hypnagogic hallucinations, and finally, sleep paralysis. Unfortunately, to date, a cure has yet to be found for the disorder, and most research on long-term pharmacological and non-pharmacological treatments only focus on their short-term effects. Current pharmacological approaches require dosage adjustments, medication switches, and use of multiple drugs to achieve their therapeutic results. This is due to the ever-changing nature of narcolepsy. Non-pharmacological approaches, on the other hand, which includes behavioral changes and disease comprehension, can help to ease patients' symptoms, but in most cases may never resolve them. Obstructive sleep apnea, or also known as sleep apnea, is a disorder characterized by repeated collapse of the upper airway during sleep, leading to low oxygen levels in the blood and also interrupted sleep. The symptoms of this condition include witness apnea, which is a collection of snoring, gasping, or choking sensation during sleep, sensation of choking upon waking, and excessive sleepiness. The condition can have very dire consequences, including systemic hypertension, higher probability of traffic accidents, and an association with diabetes mellitus. The disorder is managed by preventing the collapse of the upper airway during sleep, which is achieved via nasal continuous positive airway pressure or bilevel positive airway pressure. For patients who cannot adhere or fail to adhere to the aforementioned treatment, may be offered surgical intervention as an alternative.
The next sleep disorder is insomnia. So basically, insomnia is a difficulty in initiating or maintaining sleep. So the person with insomnia usually have poor sleep quality. This insomnia is a term to describe the presence of polysomnographic evidence of disturbance in sleep, such as long sleep latency, frequent nocturnal awakenings with prolonged wakefulness during the sleep period, and also frequent transient arousal. Let's move to restless leg syndrome. This restless leg syndrome is also known as Willis-Ekbom disease. It is a common sensory-motor neurological syndrome characterized by the urge to move the leg with unpleasant sensation deep inside the leg. So this sensation appear during the period of rest, and particularly during the evening and also during the night. And this sensation usually relieved by movement. And the paresthesia could be very unpleasant and bring to severe sleep disturbance.
Last but not least, parasomnias. Parasomnias are defined as undesirable or displeasing, verbal, motor, or behavioral that predominantly occurring during sleeping phase. These sleeping disorders can occur during non-rapid eye movement and REM and rapid eye movement REM sleep states. As you can see at the diagrams below illustrates the example of non-rapid eye movement and rapid eye movement related parasomnias. The two pictures with the purple frames illustrates the example of non-rapid eye movement parasomnias, which are sleepwalking and sleep terror, while the other two pictures with the green frames illustrates the example of rapid eye movement parasomnias, which are nightmare and recurrent isolated sleep paralysis. If you recall back, one of the symptoms of the narcolepsy are sleep paralysis, but for recurrent isolated sleep paralysis, involve multiple episodes over time, and these episodes are not connected with an underlying diagnosis of narcolepsy. The effect of parasomnias can afflict academic and occupational functioning and mood and disrupt the mood and social accommodation of an individual. In conclusion, there are 5 types of sleeping disorders that are commonly known: narcolepsy, obstructive sleep apnea, insomnia, restless leg syndrome, and parasomnias. Each type elicits different events and abnormalities due to various kinds of morbidities. Therefore, irregular and unconventional sleeping patterns are different from each other. And that brings us to the end of our presentations. Thank you for your time and attention.